after the procedures, and you know, would you recommend it for anybody? You know, I see the difference, my friend. So I want to go on and.
Yeah, I see a difference. They numb you, and takes about an hour for them to be confident, and then they I don't remember if it's the laser, because they've done 2 different times.
So this has lidocaine, tetracaine, and phenylephrine as the numbing medication.
So what are the needles injecting something?
Oh, they go in the skin.
Radiofrequency energy.
Every time you hear pop, that's radiofrequency energy going in.
So when she jumps like that, it's not the needle pokes that are bothersome.
It's the radiofrequency. Only few clients require the Pronox. That's the nitrous oxide. But we have it out there if she ever needs it.
Some people just prefer that over, and then, you know what I mean?
So Kevin, tell us a little, like, or me at least, because she was kind of telling us about it, but like what?
Oh yeah.
What is the Morpheus?
She had Morpheus. Morpheus 8 is radiofrequency microneedling.
So we are doing some microneedling at low energy here, just to help with some more of the scarring, but it's coming along really, really nicely. So Rachel is somebody who couldn't leave the house before without makeup on, and she showed up today with no makeup on, feeling good and confident. Her skin is looking great.
How are you doing?
Good.
All right. So this is the 4th Morpheus treatment. We're using Morpheus to rejuvenate the skin. We are also softening her acne scarring. She has a chronic acne scarring. We are softening some of that, but I'm very, very happy with our progress so far, as she told you. I mean, there was a big scar on her left side. I couldn't even find it. You know, I know it's there. That's why I found it. But it was. If you remember when it was glaring, you could see it from across the room. You know. Yeah. It's our Swiss Army knife.
Okay.
We use it for everything. We use it for resurfacing skin, scar mitigation. She has some serious acne.
We were using the burst mode on it to help with acne scarring.
Okay.
We kind of graduated to the regular face tip now.
While it's being done, it doesn't really hurt.
This is not bad. Oh yeah.
So, I mean, every now and then there's a little.
I mean, the patient experience is so different, even from one treatment to the next. It's so different. So as you go through your treatments, they're going to be more tolerable as your skin gets healthier. I'm sure you can even attest to that.
Oh yes,
For sure.
So with the phenylephrine, we have to be careful not to use too much of this numbing medication. But it works very, very well. Before we started using this, our patients were very uncomfortable. Additionally, we have also the gas, the nitrous oxide with oxygen, a 50-50 mix. This Pronox causes the decrease in anxiety for the client.
Collagen building and volume loss, so we had some extra. That's all right.
I have tattoos. Well, I have a rib tattoo, and that was excruciatingly painful.
So not as bad as that.
No, probably because there's numbing.
Wound, you know, it starts with a clot, right? Platelets not only form clots, platelets also have granules in them that start the whole healing process, because there are 4 distinct phases of healing. The coagulation phase, which the platelets is the boss, that's from 0 to 15 minutes. There is also the inflammatory phase, which is from 15 minutes to about 4 days. And then after that is the proliferation phase, which is about a week or so. And then you have the maturation phase or the reorganization phase. That's when you like have a scar, you know, and then you come back 20 years and the scar look different, you know? So for wound care, for clinical purposes, we don't talk about stage 4. It's 1, 2, 3. So the platelet is the main actor in the coagulation phase.
So what you're doing is you're speeding up the healing process.
Yes.
it's, you know, you have to sleep erect for the first 2 days, which is a little uncomfortable, and I just live with an ice pack on. You're super sensitive to the light, so I'm like really thankful it's a dreary day today.
Right, yeah.
Like a month and a half, 2 months ago, I had it done, and it was so bright outside. It hurt to go outside, so I'm super happy it's dreary out.
Yeah, right, so
But then, and yeah, so then like aftercare, I just have to ice it often, and I put a lot of ointment on it, and then it peels. It starts to peel, so it's like I definitely have to work my work schedule around.
How you feel, Rachel?
I feel good. My face just feels warm. Yeah, so she's still, it stays like that for several hours. That's it. She is all done. I understand it was for treating acne scars, and now this is more for like rejuvenating.
So it's almost like the next step in the process.
Yeah,
I gotcha.
I graduated.
Yeah, you graduated to the next step, right? Okay.